Hello everyone, I'm Dr. Kara Felter. I go by Dr. Kara and I use she, her pronouns. I'm happy to share with you today an overview of our curriculum in the DPT program at University of Maryland School of Medicine. Here in the Department of Physical Therapy and Rehabilitation Science, we have a couple of different degrees that we offer. Today we're going to spend most of our time talking about the DPT program. Hopefully this section of the day will give you an idea of how classes flow here at University of Maryland, Baltimore in our physical therapy program, and give you an idea of how our department is situated within the university. So at the University of Maryland, Baltimore, we are a research-intensive university. There are two schools with which we are affiliated. One is the School of Medicine, and the other is the Graduate School. Within the School of Medicine, the focus is on medical education. And then within the Graduate School, it's more on training for a research background. Our department, Physical Therapy and Rehabilitation Science, offers 2 degrees, one in each of these schools. So the DPT, which you're interviewing for today, the Doctor of Physical Therapy, falls under the School of Medicine, where the PhD in Rehabilitation Science goes along with the Graduate School. Our mission here at PTRS is to advocate for and advance societal health, so really big picture, by optimizing wellness and human movement or function through excellence in education, research, clinical practice, and service. For our PTRS vision, we want to make sure that our graduates can excel in many different areas within those categories of education, research, clinical practice, and service. Our graduates should be culturally competent, able to use evidence for practice, and make good clinical decisions using critical thinking. We also want them to be able to use evidence to enhance their clinical practice and to spur innovation. They should also be able to guide and promote the physical therapy profession at local, national, and maybe even international levels. For the degree options, like I said, we have the School of Medicine and the Graduate School that we're affiliated with. So today's interview, all about the DPT, the Doctor of Physical Therapy. This is meant to train clinical practitioners to be independent and possibly to go up for an academic position. It's a 3-year program with a lockstep curriculum, meaning that your whole cohort will take all of the same classes together. Within the graduate school, we offer the PhD in Rehabilitation Science. This is meant to prepare independent researchers who could be eligible for an academic or a research position. This takes at least 5 years, and there's a lot of different curricular offerings both here and at some of the other University of Maryland campuses. We have a few degrees that are dual degrees. So we have the Doctor of Physical Therapy with a Master of Public Health through the Graduate School. And we have a Doctor of Physical Therapy with a PhD. So a DPT PhD would be someone who has that interest in clinical practice, but also might be interested in teaching one day or doing research. To apply for any of the dual degree options, a student has to first be accepted into the DPT program. So if you're thinking about this, you're in the right place. Consider the DPT program, and then once you're in, you can do this second competitive application process for one of the dual degrees. Our program goals and student outcomes. We want to make sure that our students can function as entry-level independent providers. That means they can effectively manage care for people in medically complex settings, rehabilitation settings, and community-based settings. They should also be able to practice autonomously in a variety of healthcare environments. They should be able to provide guidance to promote wellness and prevention, not just the injury in front of them, to enhance physical performance for people in the community. They should be able to effectively, orally, and in written forms, communicate with patients, their families, different colleagues in various fields across many different healthcare professions and to the general public. They should be able to contribute to the management of physical therapy services. This could be things like marketing and making sure that they're responsible with the physical needs within a clinic. They should also be able to plan for being lifelong learners. In physical therapy, there's always more to learn, and there's a lot to do with continuing competence and staying up to date. We also want to make sure that our graduates participate in service that makes the profession of physical therapy well known and advances the community around us. And finally, we want our therapists to be able to use evidence for their critical thinking, their decision making, and so that they can participate in independent practice. To do that, we have our DPT curriculum, which is offered through a hybrid curricular design, which means that we blend traditional learning and block instruction, which I'll explain in a minute. Block instruction means that there's immersion in the different subject areas. So when you first come into PT school in your first semester, there would be one class. Instead of having 5 to 7 different classes that cover different topic areas, immersion in that one class allows you to consider the different aspects that are being taught in a variety of ways. So if we're thinking about the hip joint, we might think about how it develops, how it ages, what are the biomechanics, what's the physiology, all of those things instead of having separate classes in biomechanics, physiology, development, etc. This helps us to incorporate the strengths of many faculty. We do a lot of co-teaching and team teaching in this program. And it also lets us to integrate topics so that you're not learning about things in silos, you're really learning about them holistically. Altogether, that means an improved efficiency for your time. So this is what it looks like. I know this slide is busy, but I'll go through how it plays out and can show you the first, second, and third years of the program. After I do that, I'll go through each of these classes that you see here, and I'll tell you a little bit about what is in each one. So in the first year, you start off with basic science, which starts the day after Memorial Day usually, and then we go right into Professional Issues 1. A small break, and then the fall semester brings us to Basic Science 2, another break, and Basic Science 3 in the spring, which finishes up with Professional Issues 2. Then, in the second year, that summer, you would have Medical Issues. In the fall and the spring, you would have 3 blocks. So Musculoskeletal Issues 1 and 2, Neuromuscular Issues 1 and 2, and Integrated Clinical Experiences. So for example, in the fall, you would have 2 days a week of musculoskeletal, 2 of neuromuscular, and 1 integrated clinical experience day. And then finally, in the third year, you would have your 3 full-time clinical experiences of 11 weeks each. We're big believers here in interprofessional education, and we're lucky to be on a campus that has so many different profession students learning and learning together. So this includes physical therapists, but also doctors, nurses, pharmacists, dentists, social workers, future lawyers, and future public health workers. So we have some things that are integrated right into the curriculum where you, for example, would take coursework with students from these other health professions and be guided by interprofessional faculty. Then there are other times where there's volunteer experiences that might involve more than one profession, or even special challenges like the IPE competition. Educational spaces within our department are really meant to suit the needs of teaching a physical therapist both the didactic and practical skills that they need. So we have 1 dedicated lecture hall, 5 large spaces for lab sessions. So these, as you can see, have mat tables just like you would see in the clinic where students can learn different psychomotor skills. We have an acute care lab, which is set up like a hospital room with real hospital beds, ventilators, IVs, oxygen tanks, all the things you need to get used to in that complex medical environment, and a conference room. We have a variety of ways that we assess students in the program to make sure that you're progressing appropriately. So there's certainly written exams and quizzes, and those are meant to be formulated similar to the way that the NPTE, the Physical Therapist Licensing Exam, is structured so that it gradually gets you ready for that level of exam. We have various assignments that are meant to give you your professional skills, things like writing a professional letter or learning how to review research. And then we have performance-based exams, which are you showing us your psychomotor skills. It could be something that's a simple skills check, like showing us how you can take blood pressure, or it might be going from start to finish to introduce yourself to a pretend patient, examine, evaluate, and then treat that patient and even make treatment recommendations. We have some things that are covered in standalone modules that can be done independently. And we also use standardized patients sometimes in the curriculum. These are trained actors who portray a certain condition or illness so that a student can learn knowing in the back of their mind that they really can't do any harm. This is just an actor, but let me tell you, they are pretty realistic and students get a lot out of that. And of course, your clinical performance when you're out doing your clinical experiences full-time and part-time. So let's delve into each of those classes a little bit more. Basic Science 1 is our gross anatomy dissection class, where I mentioned we also cover a lot of other things that have to do with human anatomy, like osteology, embryology, And we do think of this from a functional standpoint because we want our students to be able to consider this from a movement standpoint. In Professional Issues 1, students learn the Code of Ethics for Physical Therapy, get exposed to the Guide for Physical Therapy Practice, and learn how to do some of the psychomotor skills like helping to roll a patient in bed or helping to keep a patient modest while doing functional activities. In Basic Science 2, there's a lot of ologies, so biology, physiology, pathology, all the ones you see up on the slide. The purpose of this class is to be a ground leveling class so that no matter what you majored in undergrad, you'll have all the foundations of basic science that you need to continue on in the program. Basic Science 3 is the PT Toolkit. This goes through things like how to measure a joint angle, how to tell how strong someone is, and some of the basic therapeutic interventions that we use in physical therapy. Professional Issues 2 is that class that I told you comes at the end of the first year. This is where you learn more about autonomous practice, documentation. We do an Americans with Disabilities assignment or ADA assignment of going into the community and trying to understand what it's like to access the community using a wheelchair. And that course ends with the white coat ceremony, which marks the end of the first year and that you all are one step closer to becoming our colleagues. In year 2, these are the more clinical blocks. So we explore concepts that build on what you learned in the first year. We have a spiral curriculum, meaning that we keep coming back to the concepts that you learned, say, in the basic science classes, but you're doing that now considering it in a more clinical level. So, well, what does this mean for a person and their family, and how do we integrate all of those concepts? So that includes things like the psychology of disability, research and evidence-based medicine, and really starting to think as more of a practitioner and putting together all of that knowledge. On the last slide and this side, you see it says DPT scholarship, and that's not, unfortunately, the kind of scholarship like you get that helps out with the finances of going to school. This is a different kind of scholarship. So what we're talking about here is being more involved and understanding the research process and thinking about research questions and how you might be able to answer those. Not that you're going to go out and do a full study as a DPT. You'd probably have either training as a PhD or perhaps be a clinical investigator working on a team that is trying to answer a rehab question. But we're starting to explore that a little bit more in this clinical year. The first class of the second year is medical issues. This deals with complex medical conditions, including cardiovascular and pulmonary, things like burns and amputation, and orthotics and prosthetics. In the fall, I mentioned you would have 3 blocks, the first of which meets 2 days a week, musculoskeletal. In the fall, musculoskeletal 1 covers the lumbar spine and the pelvis and lower extremities. In the spring, musculoskeletal 2 covers the cervical and thoracic spine, the upper extremities, and the temporomandibular joint. Another 2 days a week in this fall and spring of your second year would be in neuromuscular issues. So in NM1 in the fall, we deal with cortical and subcortical diagnoses mostly. And then in NM2 in the spring, subcortical, spinal, and peripheral diagnoses. And then that last day of the week is spent in your integrated clinical experiences. So you have 1 in the fall and 1 in the spring. Like I said, 1 day a week. And there's also different professional practice opportunities built into this block, various assignments that help you to develop as a physical therapist. And then finally, year 3, those full-time clinical experiences. So our students do 3 separate experiences of 11 weeks each. And we do have some required settings, medically complex, community-based, and a rehab elective, meaning pediatrics or geriatrics, maybe pelvic health. It could be a lot of different things, but we have over 600 clinical sites, and many of them do expose students to different specialties within physical therapy. The program requires that students do at least 1 non-local setting, meaning outside the general Baltimore area. Like I said, we have access to over 600 clinical sites nationwide. When you're out on full-time experiences, transportation and lodging are the student's responsibility. Now, sometimes 2 students end up in the same geographic area and they get a place together for that short time. There's a lot of different ways to go about this, but it is important to bring up at this time that that is something that the student needs to secure. Background checks and drug screens are also required for clinical education, and all of our policies are available in the Clinical Education Student Handbook. We also really enjoy our community here of PTs. And so our physical therapist students are involved in intramural sports, go to different professional meetings, and there's just a lot of other activities that go on outside of class. Sometimes in class and sometimes outside of class, we also have our different community events. So you can see here wellness screenings. This is going out into the community, providing things like blood pressure check, balance checks. It could be going out to a senior expo and providing balance checks and recommendations for our community neighbors. A little bit about our faculty. We have 20 core faculty members who all have doctoral degree training. We also have many associated faculty, which is another term for adjunct faculty, and these are people with specific clinical experience that help to augment our core faculty. Our faculty are actively engaged in research with over $1 million of annual funding and study really interesting things like stroke care, rehabilitation robotics, epidemiology, and physical therapy education itself. They also hold offices in various organizations, including international, national, and state level. And that's all to help us to make sure that we're meeting those 4 categories of education, research, clinical practice, and service. We have various DPT standards that are all in our student handbook, but I'll outline some of the important things right now. Students must be able to observe their patient using various senses and making real-time decisions, communicate with patients and families, as well as other coworkers, both written, verbal, and nonverbal. Be able to assess coordination and function. This is for various psychomotor skills. And to be able to perform some of those skills themselves. For cognition, our graduates and students need to be able to have timely problem solving. So this is solving based on what you see in the patient in the moment, as well as safety and good reasoning skills. And for behavioral and social, we want to make sure that our students have emotional health so that they can serve others, as well as maturity. We are accredited by CAPTE, the Commission on Accreditation in Physical Therapy Education, and our next visit is in 2027. And at this time, I'll be happy to take your questions.